Everybody, Cheng Ruan here for the Invisible Reality podcast, and I am super excited to introduce somebody that I never thought I would get to collaborate with her because I didn't even know what her field was up until I met her a couple of years ago. But today's discussion is really about collaborative medicine and how the power of collaboration actually drives change. And the collaboration has extremely good outcomes, much better patient satisfaction. We also know that the collaborative medicine also makes entrepreneurial doctors and health professionals like us feel not so lonely in the world whenever we're able to mix and mingle and think about things in a much higher order. So it really helps our patients and helps ourselves well. This is Susie. I'm going to have Susie introduce herself. So, Susie, let's introduce yourself.
Hello, I am Susie Q. I am a registered dental hygienist of over 20 years, and I'm the owner of Myofunctional Method and Houston Myofunctional Therapy. I've also created what's called the Airway team, and it's all about collaboration, networking, communication with other providers just for optimal patient care.
Awesome. Now, we're talking is because I stumbled into the field of airway medicine. It's not really talked about before. And I stumbled in this field because I was so focused on the neurodegenerative disorders, Alzheimer's, Parkinson's, mental disorders, multiple sclerosis, and such. And I found that there was a huge connection with obstructive sleep apnea, dental hygiene is a huge issue, especially with Parkinson's and Alzheimer's. And also, I found that a lot of people are ignoring their airway health, meaning like sleep apnea, et cetera, treating it. But it was because as an MD, like I'm not necessarily fully trained to understand the airway, and that's where you came in. And so let's go about what exactly is airway medicine? Like what's the whole point of this?
So, airway medicine is about how people sleep and breathe because how you breathe and sleep impacts your whole health, your gut health, your autoimmune, your mental health. Everything new starts right here.
Right.
And from there, it goes down. We start developing our health in this area, and that area impacts our whole body.
But conceptually, that makes sense, right? But what I didn't know is how complex airway health actually was.
It is.
It's extraordinarily complex.
And the biggest thing is no one provider cures or addresses airway. It takes a
Right. And I think that even for me, I have airway health issues. My daughter is sitting right there. My sister, my family, we all have airway health issues,
my
right?
family too. My daughter that's sitting right over here as well. That's what actually got me in this field.
And I think that like whenever we think about airway health, think about okay, someone maybe has airway issues, let's say sleep apnea, throw a CPAP on the person, call them there, right? There's so much more to it, right?
There's so much more to it. And then CPAPs are great. It's the gold standard for
Right.
sleep apnea, but not everyone has sleep apnea. Some people have various degrees of sleep disorder breathing. So it doesn't actually have to be apnea to be impactful on someone's health. And I think that's where healthcare and medicine miss that connect a lot. We think that it has to be apnea. And we also think about apnea as being like this obese, large person. And my daughter was underweight, very small, very petite. She never fit the mold of an apnea patient. And that's what we're learning more and more in dentistry and us. It's not that traditional idea of what an apnea patient is. It could be us. It could be our neighbors. So many.
And even in our data set here at Texas Center for Lifestyle Medicine, we saw that only 12% of people who we have diagnosed sleep apnea were actually obese, right? So that leaves out a lot of people. And over 80% of people do not snore, right? And some people think sleep apnea is snoring, but all my kids snore when they were babies, right? And so even from a pediatric standpoint, it becomes a huge deal because it is linked with attention deficit, sometimes sleep disorders, and other neurodegenerative disorders, and ADD, ADHD, which that's something I've been dealing with my whole life as well, and dyslexia. So now we're tying together airway health with all these different things in the pediatric population and adults. We're seeing similar things like inattention, bipolar disorder is a huge one with airway disorders. We're seeing a lot of major depression, anxiety, and even post-traumatic stress can be worse with people with airway health. And we've seen this in military data that a lot of people with multi-drug resistant PTSD actually have either obstructive sleep apnea or another sleep disorder, airways, right? And so I think we come to the time where we really have to address this hyper focus and what we can do in airway health. And even when I was training in functional medicine, integrative health, and lifestyle medicine, that's not really taught either. It's a thing that's like the big black box. So when I dove into the big black box, I relied on you to help me out. So it is so dang confusing.
Can be,
Me,
but
right?
it doesn't have to be.
Yeah. So let me ask you this, like, how did you even get into this in the first place?
So as I mentioned before, in dentistry for over 20 years as a dental hygienist, I went to UT here in Houston, the dental school, and I worked for some top dental offices in my career. It's very fortunate.
Yeah.
I attended some of the most prestigious dental continuing education in the country. And I always knew there was something with me, with my family. I couldn't quite put my finger on things. And then we had our first child. We had struggles with her. It actually started with her nursing. She had troubles with nursing. And I now know all the connections with that, which I didn't understand at the time. But throughout her life, we kept coming up against different barriers. And I was at a time in my dental career where I liked dentistry, but I was ready to change and do something else. And that's how I actually fell into myofunctional therapy kind of by accident, like realizing that was connecting the dots, because when you do things that change structure, you also have to address function. And so much of the time, like in dentistry, we're just looking at structures. We're never looking at the function behind what led to that structure or the why behind it. So if you only change structures and don't change functions, you're missing a big piece of the puzzle. And that's what's happening with my daughter, with all the different healthcare providers that she was seeing. And no one was collaborating, no one was communicating, understanding what this person or that person was doing. And I had some of the top doctors working on her, but again, no one was really communicating and understanding each other's roles. And that's how I got into functional.
I think the field of medicine is not known for collaboration,
Like that.
even within one system. Even if there's multiple health professions in one system, the collaboration is still not there. I think it takes a lot more than just, hey, what do you think about this patient here and there once in a while to collaborate on this patient? Because whenever you collaborate, we actually have to design a system that allows patients to flow through. So be like super cohesive, right?
And you have to develop that trust and that bond too,
Right.
knowing that when you send someone, your patient that's near and dear to you, you send them somewhere else, they're going to receive the best care. So there's a lot of things in it.
We have the ability to talk to each other. But whenever we talk to each other, we have to always have the same goal. And so one of the downfalls in healthcare professionals, especially physicians, I feel like, is that everyone thinks they're siloed into their own role. Hey, I'm just going to handle this one. You handle your thing. And if this doesn't match up, there's not a huge pulling to look at the bigger picture of what's really going on. And it's because medicine is not designed like that. Like the value proposition of a lot of physicians is a prescriptive authority, like prescribing something, whether medicine or therapy, procedure. And similar with dental professionals, like we're doing something or proceduralist, right? It's so analytical and outcome based. Sometimes there's multiple answers for one problem. And then even within this ecosystem, there's other trickle down problems that come up. For example, I learned this, and I know nothing about dental medicine over recently, but I learned that, for example, let's say if someone has sleep apnea, there's a million different ways to manipulate the airways. They're trying to cure it or try to improve it. And there's multiple different modalities, and it's super individualized, and not everyone agrees on the same thing either. And then different airway professionals have different devices that they're like specialists from a primary care standpoint, from a quarterback standpoint. That is extraordinarily different, right? And so what do we do about it?
That's hard. And you're right. There's so many different options out there. So I have a lot of people that come to me because maybe they've been to several providers and they've had this or that treatment plan and they're just overwhelmed. They don't know what to do.
Yeah.
So I try to simplify. I'm the outsider looking in.
Yeah.
And I can explain. I know enough about dentistry and about medicine where I'm between the two and
Yeah.
can explain it in a way that they can digest and help them better make decisions.
So you have this thing, you coined this thing called the Airway team, right? Let's talk about what that is. What is the Airway team?
So the Airway team is collaborative and communicative teamwork, really and truly. Like you and I met through a dentist. We were at a dinner and we happened to just sit next to each other and we became friends. And then we started working together. And then I've introduced you to some of my dental friends, ENT friends, some other people. You've introduced me to people. It's just grown. And we all appreciate each other and now understand how we run our individual practices, but we also have educated each other along the way. Like
Yeah.
you've taught me so much about things that I had no idea about functional medicine. I've learned from our ENT friend. I've learned from our ortho friend. I've learned
Right.
from all these different providers, and they all have a different specialty, but they all overlap to some degree.
Yeah.
And each patient, it's a different experience, like we said, because there's so many different options to approach something. You don't just approach sleep apnea with one method. There's so many different ways. And so learning that from all the different providers that we work with, and that's where the Airway team came, because it's learning together. It's strategizing, troubleshooting, what's not working, what can we do better? That's how we provide the best care for our patients, because nobody can do it on their own.
Collaboration seems like it takes a lot of time, a lot of effort. It doesn't have to, right? It takes a lot of money. And sometimes you get frustrated and people can get lost in the mix as well. Patients as well. And so what were your frustrations? How did you overcome this? I felt the Airways.
I think my frustrations in the beginning was the time and, like you said, the money. And you think you have to do all these different ways of creating your team or networking or meeting other providers. And I've streamlined it and found that it doesn't have to be as difficult as one thinks it is.
Yeah.
Communicating doesn't have to be as difficult as you might think it has to be. And I've troubleshooted, I've worked through, what's the easiest way we can do this? What's the best way for you? What's the best? It can be so much simpler in every way,
Every way.
in every way.
When I started the Texas Center for Lifestyle Medicine, the whole concept is a collaborative care model, collaborative care team, right? Initially, we try to do everything ourselves, try to hire everyone ourselves and stuff like that. And then I realized that it's not, but we become like, we have so many different things and we couldn't master it. From now, we're coming to narrow and double down on the actual collaboration. And it does take a lot of time. It takes a lot of effort, but there's shortcuts, right?
They are short.
Part of the shortcut is belonging to, say, a mastermind or becoming part of a network like the Airway collaborative with the Airway team, right? Or talking to people who've done it. So now you are holding your first event here. Actually, we're in the space where the event is right now.
Place.
So we watched out videos, stages behind me. For those of you who are listening to audio, just imagine it. So we're in this space right now. So we're going to manifest this, right? So what do you want to do when people show up and come here? What is the purpose?
The purpose is to meet, to not feel overwhelmed, not feel intimidated, meet some of the best providers we have in Houston. And literally, we have this amazing guest list and speaker list of people coming, and it's continuing to grow. It's even grown a little bit more over the last couple of days. So
I would say
super
it's
exciting.
I would say the best like in the world. These are world class.
Houston has literally the best providers. We are so fortunate here. So we're honored to have some great people that are going to come and be talking to us. And these are all people that I've networked with and that are part of my Airway team. And I'm going to share them with everybody else. I want them to meet all these other people and people that feel so isolated and lost and alone, and come to our event. Come meet these people. Talk to them. It's a very low-key social event. We're going to learn a lot. It's going to be high energy, lots of fun, but also very not overwhelming, not intimidating.
Yeah. It can be very intimidating, especially trying to figure out and navigate.
If you go to a big conference and there's hundreds of people there and it's a big event and you want to go and meet this one person and there's all these other people that have the same objectives as you, it's hard to do. But when you come to a smaller event, it's very conversational. You meet them on a break, and it's doable.
It is. It's very.
And they're all local.
Yeah. And so I think the biggest factor for this event is that we're putting together puzzle pieces that don't seem to match, but it actually do quite match. But because I didn't think I would ever be speaking to a biologist, biological therapist. No clue.
We have a lactation consultant. We have a
Yeah.
chiropractor coming. We have a periodontist coming. Like providers you wouldn't think would be intertwining that
Right.
we are intertwined.
Absolutely. But the big focus here is on how to collaborate, right? How do you collaborate better? How do you come up with systems that allow the collaborations? Sure, which I assume you're going to share with us, right?
Yeah.
Yeah.
Come to our event.
And lastly, I think, and let's talk about my frustrations as a health professional, actually as a CEO of Center for Lifestyle Medicine, trying to even describe this to patients, family members, is pretty taxing. And also, whenever I do call dentists and airway professionals, stuff like that, some of the stuff I'm saying are very foreign to them, right? And so we have to have a standardized way of working together and collaborating together for this to all work. What are your hopes? What are the best outcomes you want from events like these that you put on?
I want other providers to feel comfortable with how they're approaching these things and to know that they don't have to do it alone.
Yeah.
That they need the help and expertise of other providers, and maybe not in their field, but in the healthcare space, but that are like-minded, that are going to take good care of their patients and just feel at ease with that. I think we get guarded with that. I think we feel like, oh my gosh, this is my patient. I got to do everything right by them and take
Yeah.
care of them. But you're doing that through collaboration.
Right. And you do that from intention too, right? We all have amazing abilities to take care of patients. We really do. Amazing abilities. But we want 1 + 1 = 3, not 2, meaning that we want the collective goal to be something that's super special so that we're able to develop and build a system. So another part of my frustration in building this is that when we get people together, it's magic. Things happen, right? And so we see like small groups here and there of different circles, right? Like this circle and this circle. But me, I'm like the guy I'm like the kid on the playground that doesn't really belong to a clique, just to go in between. So I'm seeing that's you too. So I'm seeing that there's similarity between all this. I'm like, hey, what if we all get together for like whole, right? And so a lot of people look at me and say, hey, doc, you're an MD. Like, why are you working with dentists? It actually makes a lot of sense because this is part of the body. It's a really important part of the body. Or why are you working with device? Why are you working with organizations that don't really seem to match what you're doing? And I had a good friend, my buddy George, call me the other day. And he's, hey, I see this. You're always talking about the TMG like on social media now. What's up with that? I'm like, because there's a fibromyalgia group that's coming on that we're going to take them through a pain reduction process. It's like, what's got TMJ got to do with it? I'm like, everything. I learned these from professionals such as yourselves and dental professionals, right? And now we're seeing much larger data sets come through. And this physician, he's a brilliant functional medicine doctor, a really brilliant physician, really at the apex of this game and one of the world leaders. And to outside people, seems that these don't necessarily match. But then all of a sudden, people are starting seeing that we here at the Center for Lifestyle Medicine, we're making programs for chronic pain and fibromyalgia, dysautonomia, and Ehlers-Danlos syndrome, a lot of chronic condition that people tend to shy away from, right? That we now, because we have this team to put them in, patients have really outcomes and they're happy about it. All of a sudden, the people within the Airway team, all of a sudden are like mentioned on gigantic Facebook forums, okay, that patients put together. We all of a sudden get contact by nonprofit organizations. They want to learn more. What do y'all see that work? And so a lot of my frustration is starting to go away now, which is really nice because I'm actually being recognized by the public is because of the good outcomes that we actually have, right? The frustration doesn't have to be necessary in terms of collaboration, right? And so what are some of your biggest frustrations? You've been in the professional field for 20 years, over 20 years, right? So what were some of your biggest frustrations from 20 years ago to like today, us sitting here right now?
Dentistry, oral health. Obviously, I'm a dental hygienist, and I had no clue, never ever learned a single thing about how people breathe and sleep impacts their water. Never learned any of that in dental school. Never learned that at a past course that I went to. But now I see that it's totally intertwined. TMJ patients, pain TMJ patients are usually almost always sleep and airway patients. Oral hygiene goes directly with sleep and airway. We're going to talk about all those things and how they all intertwine. That's really helped with my frustration. I think it was just like, we weren't ever able to like fully fix it. I was like, they just kept coming back to you.
Yeah.
Like you were getting them a little bit better, but they just weren't better.
Yeah.
And, or you would prefer then, like, okay, I need you to go to the ENT, or you need to get your blood pressure under control. The dental office checked everybody's blood pressure. And there's so many people that came to us and never went to their PCP.
Yeah.
And we would find it and you need to go and see your doctor. And now I'm like, no, I know your doctor. Did you talk to your doctor? Have you done this?
Yeah. It feels better doing that.
And they're like, okay, so I'm going to follow up on this and make sure that I got this done. And I hold their hand for it. But I do. But we're all busy. We all have busy lives. We have families and professional lives and all these different things. It's just taking that patient through the process, making sure they're seeing all the right people, and making sure that their providers not going to just there.
And being part of a team feels pretty good. So we're going to share. So I'm going to be the event as well. So we're going to share our secrets to what we can really do for lab care approach. And in the grand scheme of things, I think that what you've developed Airway team is how all diagnoses and medicine should be accomplished. And it's not right now. That's how it really should be.
Excited. Come join us.
Yeah. Come join us. We will be, and the event information is being either below the video or above, whichever way it is. There's information on the webpage. For those of you who are listening on the podcast and watching video, think about collaboration as actual answer to decrease burnouts, decrease isolation of healthcare professionals, decrease depression, right? Think about collaboration as creating a brand new ecosystem. And the ecosystem is one where we don't judge each other. We always collaborate. We know we want the best for each other and best for patients. On that note, another thing to end this out with is that we have our children literally 10 feet away in that direction. And we're coordinating on the weekend. Being entrepreneurs, we can involve families. And that's one of the things that I'm going to touch on is how do you get your family teams involved? Even my 9-year-old that's sitting right there was taking social media photos of us right now.
Yep.
We are even going to talk about how we don't have to bury ourselves in work and then keep our personal lives. There's an integration that really can happen as well. And so I think that's really important. I feel that too.
The last time I lectured at an event, time before the last, my kids were there. They were part of the host. They were signing everybody in. They were doing all kinds of things, making all the little goodie bags for people. So my kids are always in.
Yeah.
With my husband.
All about communication, setting expectations. Right. Because we've been on the other side. Come to the events. We were going to have an amazing fun. It's in the space that's behind us for those of you watching the video right now.
Always fun.
Yep. Always fun. Click below to register, sign up. Be there.